Welcome to the Wellness on Purpose podcast, your go-to source for impactful, educational, and realistic information designed to propel you forward on your journey to intentional well-being, not just for today, but for the well-being of future generations. Join us as we dive into insightful conversation with industry and brand leaders in the ever-evolving landscape of the health and wellness industry. Discover the latest trends, gain valuable perspectives, and uncover practical tips to elevate your wellness journey starting today. This podcast is brought to you by Joanne's Place Health Foods, your trusted partner in health, located in the heart of Peterborough and Lindsay, Ontario. I'm your host, Marissa Laughlin, and I'm thrilled to be guiding you through this season of the Wellness on Purpose podcast. A quick reminder. The content shared in this podcast is for educational purposes only. While we strive to provide accurate and up-to-date information, it's important to remember that everyone's health journey is unique. We strongly recommend consulting with your healthcare professional or a qualified health practitioner for personalized advice tailored to your specific needs and circumstances. Hello, everyone, and welcome back to the Wellness on Purpose podcast. It's your host, Marissa, here, and today we are diving into a fascinating topic that has been making waves in the health and wellness community, and that is what people are calling the natural Ozempic for weight loss, Berberine. Berberine is actually a compound that's found in plants, and it's been traditionally used in Chinese and Ayurvedic medicine, which we're going to get into in today's topic. But we're also going to be talking about how this herb has gained its attention for the potential benefits of weight management and whether or not that is in fact actually true. Now, before we get into that conversation, I want to take a moment to introduce today's special guest. She is a true expert in this field, and she's also been on the podcast with us before. This is Dr. Mary Nagai. She is the Director of Medical and Scientific Affairs at Platinum Naturals, and she holds an MD and PhD from the University of Toronto. She has over 16 years of experience as a clinical scientist and is an advocate for natural integrative medicine. She brings a wealth of knowledge and expertise to today's discussion, and I'm so happy to have her here with us today. So without further ado, please join me in welcoming Dr. Mary Nagai onto the podcast, and let's chat about berberine and whether or not this is an effective tool to be using to support weight loss. Good morning. Welcome to the Wellness on Purpose podcast. Thank you so much for joining us again. I know we had really great feedback from our last episode together that our community loved learning about. So I'm so happy to have you back on the podcast. We're going to dive deep into a conversation today about the natural Ozempic, which is berberine, and talking about weight loss and healthy weight loss and what that can look like in our society today. So let's just start with the basics. We know people are using or, hearing that berberine is this magic pill, but I would love to really talk about what is berberine and what does it do for the body? Where does it come from?
So berberine is found in a variety of plants, and it's an alkaloid. It is a very common practice to use the root and the stem and the leaves. At Platinum Naturals, we're using Berberis aristata, and we're only using the root. As everyone knows, anything that's in a root is very concentrated, and then as the nutrients make their way up the stem and out to the leaves, it gets watered down, so to speak, or less concentrated. So regardless of whether you're using berberine, a supplement that contains the root, the stem, or the leaves, or just the root and the leaves, or just the root, the berberine is berberine. Okay, regardless of the source that you use, the benefits of berberine have been found to be very similar across the board. It's just the concentration and the amount of berberine that you're going to have to take to achieve those results. Berberine has been used, the Berberine aristata, the one that we use at Platinum Naturals, has been used for medicinal purposes in Chinese medicine for a variety of health conditions. And the most common use is to help manage blood sugar levels and to manage your lipid levels, primarily your cholesterol and triglyceride levels. But berberine in traditional Chinese medicine has been used and shown to be beneficial for managing things like inflammation, wound healing, reducing fever. It's been shown to help with digestion, and I'm going to talk about that a little later, and can help reduce infections. But all of those uses really come back to how well your body is able to optimize its blood sugar and lipid levels. Because we know that blood sugar, when it's out of control, whether it swings too high or too low, influences how your body is metabolizing and creating energy for all the tissues and cells.
So I'm sure we're going to go a little bit farther into talking about blood sugar regulation because I feel like it probably pairs with the conversation about weight loss. As I said, this is an ingredient that people are using, they are recommending, and we've seen a lot of people come into the store asking for berberine. So when it comes to weight loss and this, conversation that people are having about how impactful taking berberine can be for weight loss, how do those two go hand in hand?
So berberine, like Ozempic, has traditionally been used and studied for its benefits of managing or optimizing your blood glucose levels. And like Ozempic, berberine can help you if you have too much blood sugar, and it can help you if you have not enough blood sugar, so you're always low. So what berberine does, like Ozempic, it manages those swings that you don't want. You don't want swings of too much and too low. You want it, you naturally we have swings, but they're not big swings. They're pretty small swings, right? Between meals, we have swings. If you're stressed, you're going to have swings because when we're stressed, we eat emotionally. We crave food. We crave sugar. We don't necessarily crave fruits and vegetables, right? Particularly vegetables, but we can crave fruit because fruit is sweet, right? So it gives us those swings. And what berberine does is it decreases those swings. It tells our pancreas you need more insulin. We need to drive that glucose into cells. It reduces the resistance of our liver cells and our peripheral tissue, like our muscles, from resisting the benefits of insulin to drive the glucose in. So it helps drive glucose into cells, gets it out of our circulation and into safe places. And it reduces our liver synthesis of glucose when we don't need it because we have too much. And then it supports our liver to make glucose when we don't have enough. So it really optimizes the amount of glucose in our circulation and how much is being taken up by our peripheral tissues.
I think it's important here to highlight something that you just said about all of the things that fluctuate our blood sugar. As you mentioned, obviously the food that we eat, but a lot of our lifestyle habits really impact that fluctuation as well too. And I think that's what's so troublesome about this conversation about how berberine can be this magic pill is because people think that they don't need to adjust their lifestyle habits or their eating habits or manage their stress and just take a pill. And that's where I think this conversation gets quite dangerous for people because if you stop taking it, you're going to have blood sugar fluctuations more rapidly. It's not going to be as nice, of that stream up and down. We're going to
Mhm.
see those high spikes and those big drops. And that and what I know is really affecting people's weight is that constant fluctuation, not utilizing the glucose through the bloodstream for the rest of the body. And just to circle back here too about glucose, we know how important it is for our cells, for our muscles, for our body to have energy, for it to move, for it to do the simple things that we need to on a day-to-day basis. So we need healthy glucose levels. It's just that we need to be able to manage it. And some people can be doing all of the right things in their lifestyle and still not have the greatest blood sugar regulation, and they might be supplementing with something like berberine. But I just want to highlight it's important for people who are looking for supplementation to support weight loss or blood sugar regulation that a lot of that comes from your lifestyle habits as well. So when it comes to berberine, do you think that people should be taking it specifically for weight loss, or where would you like our community to use berberine, and how can it be supportive for other things?
So most people who are striving to lose weight have a primary medical or health concern. So a lot of people who are gaining weight, they try a diet, it works, and it doesn't work. And that itself is stress. People don't realize that every time you try to go on a magic diet because you've heard this diet works for X number of people, like the keto diet, it works for a lot of people. But keto diet also adds stress for some people and they don't lose the weight they want. Some people try intermittent fasting, but their body, their health doesn't allow them to really support intermittent fasting. So it really depends not just on your lifestyle, but on your overall health. So if you know that you experience periods of hyperglycemia where you're fatigued, you get headaches, right? Because of what you're eating, it could be that maybe you're eating too much fruit and that natural sugar is too much for your body. That can happen. It could be that you're under this stress of wanting to lose weight and you're using this diet and you've tried other diets and it's like a yo-yo, right? That is stress. If you want to lose weight, you have to look at the big picture of your lifestyle, what's worked for you in the past, what hasn't worked, and then how that diet makes you feel. Because if that diet makes your blood sugars swing, then you're not going to lose weight. And it's actually detrimental. And in those cases, taking berberine during those periods of stress is going to level off your blood sugar. And the secondary gain will be that you might lose weight. But there was a review in 2022 of 28 studies that looked at berberine and body weight and BMI, your body mass index. And it showed that there was significant decreases in both body weight and BMI when you took 1 gram or more of berberine a day for 8 weeks. So everyone's talking about this review of 28 studies. You hear it being out there on social media, or they talk about individual studies. What they fail to talk about is that the second part of the discussion in that paper, and that's that all of these studies in the review had a high risk of bias. And the outcomes of the individuals' studies each of those 28 studies was very inconsistent. The amount and the formulations of berberine used in those studies varied tremendously, but more importantly, all the participants in that study had diabetes or fatty liver disease. None of these studies looked at participants who were healthy. Most of these patients were over 45, 50. None of them were healthy or without any medical conditions. But most importantly, none of them were in their 20s and 30s, which is the age at which a lot of people are looking at Ozempic and berberine. So you have to take what you're hearing with a grain of salt because you're not hearing the whole story.
Thank you for bringing that up, because that we want to grab onto any piece of information that's been like, the headlines or the proven aspect of it. But there's so much information to what goes into looking at research and studies. Again, age, if there's any, pre-diabetic or any other health concerns. So it's important to look at all factors of every supplement and drug research that they have out there. So happy that you brought awareness to that. But you're right. It is that age group, 20, 30, even sometimes I would say menopausal women who are having these conversations with us about looking to lose weight. So the other aspect too, I just want to mention, I know you mentioned lifestyle and blood sugar regulation and all of the things that impact stress in a way that we see that skyrocket and the drop. But one thing that you didn't mention yet was actually sleep. Do you think that people's sleep cycles have an impact on their blood sugar regulation?
Yeah, for sure. Because we know from many, many studies of perimenopausal women and women in menopause and postmenopause, we know that during those periods, women gain weight. We also know that it's very stressful when you don't get enough sleep. Women who are in perimenopause and they get up in the middle of the night, umpteen times, just so tough to go take a shower, or women and even men, when they're kind of pre-diabetic, women and including women who have just given birth, had gestational diabetes, and now their blood sugars are starting to come down to where they were pre-pregnancy. We know that in the middle of the night, people get up as they age, not just to go to the bathroom, but sometimes they have to get up and get a snack. And that is an indication that your body is telling you that your blood sugar is low and that you need to boost that glucose. You need to go get a snack. That snack is usually a carb or orange juice or something that has sugar in it. You go to the fridge, you're looking for something that's sweet, right? And then you try and go back to sleep. But that sleep disturbance is stress, right? And it should be telling you that there's something not quite right in your sugar balance because you had to go to the fridge, right?
Yep.
That is emotional eating. So sleep surely and definitely does play a role in your body's ability to manage its glucose, its lipids, and your body weight. So they're all kind of intertwined.
It definitely takes looking at all aspects of your life. And I remember when I was in school, we talked a lot about waking up at the same time every single night. And at first, there was a lot of conversation around it being specifically hormonal women. It's just their hormones fluctuating, it's their cortisol starting to spike. And yes, that can very well be true, but a lot of that can actually be looked at in terms of irregular blood sugar as well. So something that I recommended, and correct me if I'm wrong, but if this is something that is quite consistent every single night for someone, I say have something before you go to bed that has some
Yeah,
protein, that has some fiber and some fat that's going to keep you satiated through the night. Is that a good recommendation?
that's a perfect recommendation. Yeah, because that reduces your getting up in the middle of the night, right? And it helps you get a better sleep because quality of sleep is what's very important. Everybody needs different quantities of sleep. Some people can go off of 3, 4 hours. Other people, if they don't get that 8 hours, they're zombies. But it's not just quantity, it's the quality of that sleep. So maybe you only sleep 3 or 4 hours, but you're getting quality sleep. And that's what's important.
Quick pause in today's episode because I want to talk to you about a transformational online program. In case you missed it, Joanne's Place released an online program called the Wellness on Purpose Program to Educate You last year. And our intention with this program is to make this education more accessible for our community to better support their wellness journeys. This program promotes sustainable and realistic changes, and it really focuses on the foundational pillars of every single person's health: your nutrition, your sleep, your stress, and also movement. If you want to get started today, click the link in the description below to learn more about the Wellness on Purpose program. By the way, it's completely free and you can move at your own pace from the comfort of your own home. Now let's get back to the episode. Coming back to berberine, you quickly mentioned off some things at the beginning about why people would take berberine. So we know the number one reason would be to help with blood sugar regulation, but what would be the other top two reasons that somebody would take berberine supplementation?
So it could be someone who had gestational diabetes, which is a big topic right now in pregnancy. A lot of women are experiencing gestational diabetes, and they're being told you're at risk of developing diabetes as you age. And for some women, that gestational diabetes doesn't resolve completely. And it's more and more common as more and more women are requiring fertility treatments with all these additional hormone injections. It's a very complicated process to carry that pregnancy through. And a lot of those women do develop gestational diabetes. those women, after they finish breastfeeding their infant, if their blood sugars are still on the little higher normal side, they may be asked to monitor their glucose. Those are women who might benefit from taking berberine, and they can talk to their family doctor about that now, because berberine has been proposed to be the first line of treatment for people who are pre-diabetic, so their blood sugar levels are a little high, but not high enough to be considered diabetic. Now we're looking at it. It's been very, very effective at managing that, the pre-diabetic phase, very effective at complementing metformin and sometimes completely reducing the need for metformin, sometimes lowering the dose, which is very effective because some people's metformin levels are so high, they're almost at the border of needing insulin. It's very effective for people who have high cholesterol triglycerides on a statin, or their doctors are telling them, you're so close to needing a statin. If you can just tweak your lifestyle, which is really hard to do. And sometimes that tweak doesn't do anything and people get very disappointed, right? And that is an added stress as well, knowing, oh my goodness, I might end up on a statin. I might end up on metformin. I have to do something. Those are the people who would benefit from berberine. So it's a very large group of people who don't necessarily have high cholesterol, high triglycerides, or diabetic, who can benefit from berberine. So in that pre-disease stage, which can be 10, 15 years before you're even diagnosed. But if you've been told your levels every time you do a fasting blood sample, your glucose is high, your lipids are high, they can benefit from berberine, including those who are diabetic and on statins. Berberine can benefit them as well and maybe reduce their need for medication temporarily.
Good to know. Now, question for you about supplementing with berberine. Is it something that needs to build up in the system, or is it that if you took a berberine capsule, say at a meal or something, it's going to have an effect right away?
So it takes about 3 or 4 days for your body to realize it's there and to use it. It's particularly, and I forgot to mention this, people who are under stress, be it positive or negative stress, be it acute or chronic stress, can benefit from using berberine as well, because those people also have these big swings of glucose, and it's usually high rather than low, but they can swing high and low as well. And for anybody who is thinking of using berberine, whether because of acute or chronic stress, pre-diabetes, pre-hyperglycemia, hypercholesterolemia, or too much triglycerides, or you're already diagnosed, right? For plant naturals, our dose is 4 a day. I always say take one, which is only 250 milligrams, but everybody has a different sensitivity. So take one and see how you do. Take it for about 3 or 4 days and just see how you feel. And then if you feel that you're still craving sugar, you still, you feel like you have fatigue or headaches, which can be due to too much sugar, and people will know. If they're eating a lot of sugar, they'll know why they have this headache and this fatigue and this funny feeling. Maybe they have a bit of tummy upset from all the sugar. And even if you're diabetic or you'll know if you are stressed because you have additional stress outside of your disease, you'll know because you just don't, your metformin, you'll feel it just isn't working for you. You'll know because those people know their bodies. Then take another and see how you feel. And do that for 3 or 4 days. And let your body get used to having that berberine. And then if you need to, add a third. So it could take you anywhere from 2 to 3 to 4 weeks to figure this out. But once your body gets used to seeing the berberine, its ability to adapt to another dose, another 250 milligrams, will be quicker, and you'll know.
Okay. I have seen this as a recommendation. And again, we say this at the end of our podcast as well. Always consult with your practitioner on obviously dosages and things like that. But
Mhm.
one thing that I've seen recommended is people to take berberine, like we'll say average healthy individuals with like that are not pre-diabetic, that are not
Okay.
pregnant, but
Yeah.
people who are under chronic stress. And the recommendation I saw was if you're somebody who's under chronic stress, and you know that you're eating a meal, say that's much higher in carbohydrates, let's say a pizza, not something that you would normally have. It's like taking the berberine with that meal to reduce the impact. But are you saying that you would need to do that like enough days in advance for your body to recognize that berberine, or can it work in that moment?
If you take 1,000 milligrams, some of the benefit you will capture right
Okay.
away, but you're not going to capture the full benefit. And you have to remember that unless you're taking berberine in a healthy oil like Platinum Naturals, 91% of that berberine doesn't even get absorbed. It gets kicked out by the intestinal cell wall. It doesn't get absorbed because it gets metabolized in the cell and kicked out or just rejected by a multi-drug resistant receptor. It just kicks it out. So
Okay.
they say there's only about one, at the end of the day, the bioavailability of berberine is about 1% if it's not in a healthy oil. So that's why people feel they need to take that 1,000 because only 1% is actually getting into circulation, right? And that's why if you look and you hear some of the on other podcasts and social media, they're talking about 1,000 milligrams or a gram or 2 grams. And it's because you're only getting the benefit of about 1% of that. Whereas for us, it's really important that you take one, and I always say less is more, and go slow because that 250 milligrams in one capsule is 4 times more bioavailable. And our absorption is close to 100, is between 95 and 100%. So,
Amazing.
and then the sustainability within and the bioavailability is 4 times that. So you're not just getting 250 milligrams, you're getting the effects of 250 milligrams almost times 4 because of its sustainability. It just keeps circulating. And that's where the big difference is. And that's why for us, you have to start low and go slow.
Okay. Um, And that's what's so unique about Platinum's new Berberine 4X. And I just want you to talk a little bit more about this formulation because this is not one we've seen on the market. As you said, it is in the Omega suspended delivery system, which all Platinum Natural products are. So tell me what's so unique about this formula and why it is
Okay.
so superior for the absorption.
So we formulated this product to help optimize blood glucose and your cardiovascular health. So it has the berberine, but in addition, it has chromium picolinate. And chromium picolinate helps insulin drive glucose into your cell. So it helps reduce circulating blood glucose. And it also has eucomia. And eucomia helps loosen your arteries so that the the blood glucose and the lipids that are circulating in your circulation can get by without squeezing through tight pipes, our arteries. And I like to call our arteries pipes. And usually they're very supple and they'll give. But if you've had pre-diabetes or kind of questionable blood glucose levels and high lipid levels for a long period of time, like they say 10 years before you're diagnosed, then your arteries are what we call, or can have sections that we call lead pipe, where there's so much clog, so much gunk sticking to your arteries that it's hard for those blood cells and lipids and glucose, all those nutrients to get through. So what we do is we added eucomia so that eucomia would loosen those arteries so your heart doesn't have to pump so hard to get the nutrients through. So it relaxes your heart a bit and the heart goes, oh, wow, this is so much better. My arteries are not as tight, right? They're a little looser. It helps reduce your blood pressure because we know that diabetes, pre-diabetes goes hand in hand with the with your blood pressure. And all of those things together, people get warnings all the time. Oh, your blood pressure is a little high, but it's not so high that you need medication. Oh, your blood sugar was a little high, but we don't need medication right now. So all of those things we know go hand in hand. It's like that ugly triad, okay? And that's the reason why our berberine has 4 times has berberine, chromium, and eucomia, because we know that it's an ugly triad. And you can't just manage one without managing the other. And then it contains flaxseed oil. And a lot of people like have been hearing that good and bad things about flaxseed oil, but flaxseed oil next to fish oil is one of the most beneficial oils that you can use. If you can't have fish, then a good vegetarian vegan oil is flax. And for women, it's really good because the phytoestrogen that's in flaxseed oil is a lignin. And that phytoestrogen, that lignin binds to the beta receptors, which are in our brain, our hearts, our liver, our arteries. And we all know that as women approach menopause and go through menopause, our risk of heart disease just escalates. And we now match our male counterparts. But when you take a phytoestrogen that is a healthy phytoestrogen, like a lignin, like from flaxseed oil or eucomia, and eucomia also has the same phytoestrogen, then it not only supports, in this case, your blood sugar and your cholesterol levels, but it helps your arteries and your heart benefit because now it's going to make that estrogen that it needs, right? It's going to, the the lignin and the eucomia are going to bind to those beta receptors, which are very important for women because it replaces the estradiol that we're not able to make. And it gets rid of that brain fog. It helps your brain feel like itself again, right? So it adds that little bit extra, particularly for women, that phytoestrogen, the good phytoestrogen. So there's not a lot, but a little every day definitely will help you. Yeah.
Amazing. So many benefits to berberine and this formula in general of having the other cofactors in there as well, which is amazing. And as I said, there's nothing I've seen on the market that's suspended in an omega. So love that. Now, we talked about lots of benefits, but is there any side effects or precautions that people should be aware of about taking berberine?
Yeah. So if you are diabetic, if you're taking any diabetes medication, you should definitely consult with your healthcare practitioner. Let them know you want to try the berberine. They're not going to say no because there's a recommendation, like I said, to make berberine our first line of management. So tell them you want to try the berberine, and they'll most likely tell you you need to monitor your blood glucose a little more closely during this period till you figure out the dose with them. It's also, if you're taking any prescription medication, you should consult your healthcare practitioner because berberine is known to metabolize a number of medications. So it may mean that your dose of your medication needs to increase temporarily till your body resets itself, and then they'll readjust your medication dose after about a month or two. Okay? So And for some medications, you won't have to have any adjustments or any monitoring, but consult. The best person to consult is your pharmacist.
And they have, like, at least what I've heard is they have a multitude of database and information to see exactly what could counterindicate taking supplements
Yes.
versus your medication as well.
Yeah. So speak to your pharmacist.
Yeah, good tip. Become best friends with them so that you can ask them any question that you possibly need.
Absolutely. Yeah.
Amazing. Any final words about berberine, natural Ozempic for our listeners? Any key takeaways that you want to make sure get across here to our listeners?
Yeah. So berberine is not a natural Ozempic, and you need to treat it with respect. You can't just don't go by it because, oh, someone on social media took it and they lost 20 pounds. Please do not use berberine as your natural Ozempic. Use it to manage your blood glucose. Use it to manage your cholesterol and triglyceride levels. And there's lots of reasons why you could take it and why you should take it. From people under stress, people under, whether it's positive or negative stress. Maybe you're getting married and you're like, oh my goodness, I'm so stressed with this wedding planning. And you're not eating well. You're trying to maintain, a healthy weight. You're trying to maintain a healthy diet, right? But this stress has just got you emotionally eating, and, you can just feel that you're overwhelmed. Try berberine because it'll get rid of that emotional eating. It'll get rid of those sugar highs and lows. And a secondary benefit may be that you lose weight, maybe not, but it gets rid of those sugar swings, which are long-term, can have long-term, do long-term harm for you. So if you're under stress, take your stress supplement. And if you're still having those cravings, those headaches, the fatigue, to add berberine. If you are pre-diabetic, your doctor says you're kind of on the verge of needing a statin, take berberine. If you're going through menopause and you have a family history of heart disease, your lipid levels are your doctor just put you on a statin, you want to try and mitigate that, try berberine. So a lot of reasons to take berberine. And then the side benefit could be that you lose weight. You may not lose weight, like I said. The results are inconclusive. But don't just take berberine to lose weight. It's going to be another yo-yo. You're going to see it and you're going to get disappointed. And if you have sustained any negative adverse reactions to your liver and your pancreas, you're going to be more stressed and more upset. So don't take it to lose weight directly. Take it as a secondary benefit, but use it for what it's been shown to do, and that's to manage your blood sugar levels and your cholesterol and triglyceride levels.
Thank you so much for setting the record straight there. I think it's really important that we have these conversations, especially in the natural health space, that people are starting to tune into more, which is really important. So thank you so much for sharing your knowledge, setting the record straight, and giving our listeners some really important takeaways for lifestyle changes and for whether or not they should supplement with berberine. And for our listeners, if you have any other questions about berberine, whether or not it is right for you, pop into one of our Joanne's Place locations because our staff would be happy to have this conversation with you as well. So thank you so much again for joining us on the podcast. It's been such a pleasure.
Oh, you're welcome. It was a pleasure to be on your podcast again.
Thank you for joining us for another insightful episode of the Wellness on Purpose podcast. We hope you found the information valuable and inspiring to support you along your wellness journey. Before we go, a quick reminder. The content shared in this podcast is for educational purposes only. While we strive to provide accurate and up-to-date information, it's important to remember that everyone's health journey is unique. We strongly recommend consulting with your healthcare professional or a qualified health practitioner for personalized advice tailored to your specific needs and circumstances. Your well-being is a priority, and speaking to a healthcare professional ensures that you receive guidance that best aligns with your individualized health goals. If you have any questions or topics you'd like us to cover in future episodes, please reach out to us through our website. That's all for now. I hope you stay well, stay informed, and remember, your health is your greatest wealth. Until next time, take care.